Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Did the holidays stress you out? We're going to talk about stress management. Is your New Year's resolution to lose weight? Are you a candidate for the new injectable medicine? But we're going to talk about medical and surgical management of obesity. And are you at risk for an aneurysm? We've got a vascular surgeon. Plus, we'll hear about the great work done by Kentucky Humanities. My first guest is Ms. Rae Holliday, who is our new licensed marriage and family therapist at Family Practice Associates. Welcome.
Thank you so much.
Now, Raleigh Kincaid, our original therapist, has retired, and you're there, and you're as busy as can be already, but tell us a little bit about yourself.
Yes. I am a North Carolina native.
Oh, well.
Yes, yes. I've heard a lot about like the basketball that is, you know, the religion of basketball here.
Yes.
I'm learning. So I moved to Kentucky last year to be with my partner. I've been a therapist I've been in practice going on 7 years, which feels like a long time. So,
you know, when you say therapist, you know,
yes.
we've just gotten through the holidays and we've all got this holiday stress, or just stress in general. So how do you know if it's a problem?
That is a really good question. I think one of the cues is to kind of ask yourself, is this normal for me, or do I not feel like myself? So sometimes when we get overwhelmed, when we get really stressed, we start doing things or saying things or thinking things that kind of surprise us. So I think a good cue is this my normal stress level? Is this my normal response to stress, or does this not feel like me?
Are there certain things that you might do that indicates you're stressed out, like risky behavior, abnormal eating, abnormal drinking, especially at the holidays?
For sure. So I was thinking about this conversation that we were going to have and kind of thinking about what are those domains that we could look for some warning signs of increased stress or maybe mismanagement of stress. And so I was thinking about physical signs, right? The basics: sleep, eat, move. So looking for those warning signs. Am I sleeping like I normally sleep, or am I up at night thinking about all of the things that I have to do, right? Am I eating in a way that's good for my body, that makes me feel good? Am I moving my body, right? So some of the ways to manage those physical symptoms would be make sure that you're prioritizing rest, make sure that you're putting food in your body that feels good, make sure you're moving your body, right? Tying into that is that moderation of alcohol or other substances. So the holidays oftentimes bring indulgence, right? In food, in booze. So being mindful of, you know, am I having this glass of wine at this family meal because I want to and I like it, or am I using this to kind of lower my anxiety so that I can operate in
Cope with family.
Am I coping with family, right? That's my whole job. How do we cope with family? So another kind of domain of well-being, or another place in life to look for, am I doing well or am I not doing well, is in our relationships, right? So the holidays can make us really stressed. They can make us snappy with our people, extra irritable, right? They can make us kind of create these like avoidance behaviors. So it stresses me out to be around you, I'm just going to withdraw. Sometimes like resentment builds. The holidays surface stuff that's already there, right? Patterns in relationships, or coping strategies that we use that aren't so healthy, like that excessive drinking. So if our relational stress is getting to us, you know, we notice I'm avoiding certain people, I'm getting really snappy, I'm short-tempered, doing some self-care things in that relational domain, like setting boundaries, saying no, right? Being mindful of your bandwidth. I have this much time and this much energy and this much attention, and this is how I'm going to funnel those things. So saying no, delegating, asking for support. There's a lot going on at the holidays. We want to make sure that not one person in the family or in the group is stuck with all of the responsibilities.
And because you are a therapist, there's nothing
Yes.
wrong with seeing a therapist.
Absolutely.
It's not a sign of weakness, actually it's a sign of strength.
Yes, it is. So talking to a therapist, talking to your PCP even, your primary care provider, of which, you know, this is what we're doing here. So if you're struggling, if you feel like you're not coping well, if you feel like your response to the holiday stress is not typical of you, ask your primary care provider. Come make an appointment with me. We can talk about it.
Well, that's great information. We thanks for all you do, and we thanks for coming in and talking about it.
Thank you so much, Dr. Fox.
We'll be right back.